Welcome to Aesthetic Visionaries, the show where we hear from bold entrepreneurs building and growing a thriving aesthetic practice. Let's get into it.
All right. Welcome, everyone. And thank you for joining our Aesthetic Visionaries Fireside Chat. We're excited you're here. By way of introduction, I'm Michaela, and I'm a lead practice success manager here at Moxie. In just a moment, I'll hand things over to two incredible aesthetics leaders, Dr. Sam Lynch and David Weir. To introduce our speakers, Dr. Sam Lynch was a pioneer in regenerative medicine before regenerative medicine was a buzzword. He's one of the world's foremost authorities on growth factors to tissue regeneration. He has over 250 publications and patents and has given hundreds of lectures in over 25 countries. His patented combination of highly pure recombinant platelet-derived growth factor and tissue-specific biomaterials have been used in the treatment of over 5 million patients. Dr. Lynch is also the founder and CEO of Lynch Regenerative Medicine, which last year launched sales of ariessence Pure PDGF Plus for use in aesthetic medicine, plastic surgery, and dermatology. And the aesthetic world has not stopped buzzing since. Next, we have David Weir, MSN, APRN, FNPC. David has a passion for beauty, skincare, and educating people on how to achieve their best look for 17 years. You may recognize him from his speaking sessions at numerous conferences, including Aesthetic Extender Symposium. David first started his journey becoming a certified makeup artist and skincare expert, and he's now a certified nurse practitioner, combining his experience in beauty, skincare, education, an artful eye for aesthetics, and advanced training under Dr. Rod Rohrich. David adds a wealth of knowledge and research on the latest cutting-edge, non-invasive beauty procedures to keep clients looking as good as they feel. And while this webinar is not about Moxie, I'd love to share a quick intro for those of you who are meeting us for the first time. Moxie is the growth and operating engine supporting 500 of the fastest growing aesthetics practices in the United States. And while we help med spa entrepreneurs reach their multi-million growth with marketing, compliance, coaching, software, VIP pricing, all in one place. So if you're interested in learning more or booking a free med spa strategy session, or even a customized P&L review, I encourage you to visit joinmoxie.com. Enough about us, let's get to the good stuff. When we created our Aesthetic Visionary series, our goal was simple: to give influential injectors and entrepreneurs a spotlight and space to have meaningful conversations that educate and inspire. With that, I could not be happier to hand it over to Dr. Lynch and David.
Thank you very, very much. It's a real honor and pleasure to be with you all tonight. And the true honor to be sharing this presentation with David Weir, who's just the master clinician. So how we've organized this is I'm going to present a little bit about, the science and what is ariessence, what is PDGF, how does it work naturally in our bodies. David's going to show some before and after, some amazing cases. And then as we have time, I have more cases also lined up. So let's dive right into it. So growth factors, a huge buzzword, right? We've all heard about growth factors, but really what are growth factors and how do they help us in skin healing and in aesthetics? So just a very simple definition to start us off so we're all on the same page. Growth factors are a group of natural proteins. They're in our blood as we're sitting here today, circulating in all of our platelets inside our blood. And they are capable of stimulating a variety of cell processes that are just critical to wound healing and rejuvenation and regeneration. Among those processes that growth factors can stimulate, cell proliferation, so they can stimulate the proliferation of your skin fibroblasts and your regenerative stem cells. They also can stimulate the migration, what we call chemotaxis. They also can enhance the blood supply to your skin, right? That's critical. It doesn't do any good to have a whole bunch of cells if they're in a very poor, oxygen deficient environment. You want those cells to be in a very oxygenated, nutrient rich environment. And that's what bringing in those new blood vessels do. And then of course, growth factors can stimulate collagen, elastin, natural hyaluronic acid, all the wonderful extracellular matrix components. But not all growth factors are the same. There's only one growth factor that has received FDA approval, and that is platelet-derived growth factor BB, PDGF BB. And that's what we're going to be talking about tonight. So how does PDGF work naturally in our body? Well, it is so important to us as human beings, as a species, that PDGF is one of the most highly conserved proteins in all of nature. What does that mean? It means that the PDGF that's in the earliest mammals, I'm going to use the examples of mice and rats, for example, and the PDGF that's in us as humans is virtually identical. So you can take PDGF from a mouse and apply it on a human wound, and it will actually stimulate healing, and vice versa. You can take PDGF from a human and apply it on a mouse wound, and it will stimulate healing of the mouse wound. It's that critical so that all mammals have PDGF, and it's been critical to our very survival. It is naturally found in the blood platelets and as we develop embryologically. And again, it stimulates events that are critical to skin healing, as I've already talked about. So it's important to understand, though, that the PDGF is not just freely floating in our bodies, but it's actually contained in the platelets in our blood. And why is that important? Well, if you had this incredibly potent stimulatory growth factor just freely floating in our blood, and it could just stimulate, cell growth and proliferation, we all might be like 10,000 pounds by the time you're my age. So we probably don't want to be that. That's probably not a good thing. So what has evolved is that this incredibly potent protein is contained inside platelets in our blood, so that what happens when you have an injury, when you do microneedling in the face, when you do any sort of plastic surgery or dermatologic surgery, or you cut yourself in the kitchen, right? Or anytime you have any sort of an injury, what happens? You have a blood clot that forms, right? What's a blood clot? It's where the platelets all stick together and they stick inside a fibrin meshwork. But when those platelets stick together to form a blood clot, they release PDGF right at that site of injury. So you don't have PDGF floating around naturally in the body. It's only released right where you need it, right where you need to stimulate that new skin growth or new healing. So those activated platelets, which they clot and stick together, release PDGF. And then it does all the wonderful things that I've already talked about. One thing I didn't mention previously is that it also stimulates cell survival. It's what we call an anti-apoptotic protein. Causes those wonderful cells that you're regenerating to actually live longer. So that's great, right? Wonderful to have the PDGF naturally present in our body, as well as some of these other growth factors. But as we all know, right, we don't heal as well as adults, especially older adults, as we did when we were young, when we were newborns or just, 3, 4, 5, 6 years old. One of the main reasons for that is because the level of growth factors naturally decline with age in our bodies. So this is data from a publication where they looked at different growth factors and they showed how the level of growth factors decline with age. And of course, we all know we can have different platelet counts, not only from patient to patient, but even within our own bodies, we can have different platelet counts over time. And that is why PRP and PRF is so variable. So you might be thinking like, well, I can draw blood from my patient, centrifuge down the platelets, activate them, in the test tube, and maybe I can get, growth factors. And we know that sometimes, hey, PRP works okay, PRF, right? Other times it doesn't seem to do hardly anything. And one of the main reasons for that is that the level of growth factors and the level of platelets in our bodies varies with time. And as I like to say, the very patients that need the healing boost the most, the very patients that need a boost to their skin rejuvenation and regeneration the most, they need it the most because they have the poorest quality blood to start with. So, you're really thinking like, well, I'm going to use a poor quality blood, let's say in this older patient, right? Well, then the PRP and PRF that you're going to get at the end of that process is probably not going to be great quality, right? So again, the very patients that need the healing boost the most have the lowest level of growth factors. Normally, that's why they need the healing boost. Okay, so what have we done to overcome that? So just like insulin is made. So insulin a long time ago used to be purified out of pig or bovine pancreases. For the last 20, 25 years, it's been made using recombinant technique. It's a fancy term for producing insulin in a pharmaceutically pure, potent preparation. We make PDGF in exactly that same way, using that same process. So the PDGF that's found in ariessence is manufactured in a pharmaceutical sterile bioreactor to exacting pharmaceutical standards. And every batch of it is clinically tested for purity, potency, consistency, and sterility. The best part of that for you all is that it is quick and easy to use. It's right off the shelf, and you don't have to worry about the patient-to-patient variability. So it's easier for you, it's less stressful for you, and it's much more consistent. Graph shows how PDGF can compare to PRP. So I've already mentioned many of these things. The only thing I think I would point out again is that the concentration of PDGF in ariessence is thousands of times greater than the concentration you could get even in your best PRP. PDGF, so easy and convenient, don't need specialized equipment. It's ready to use off the shelf. You don't have to draw blood. There's no preparation time. Concentration of growth factors is much higher than you could get in PRP and PRF. And it's consistent from patient to patient, and it's sterile. So that's a little bit about how PDGF, works and how it's found in ariessence. How does it work for you and your patients, and why would you want to consider using it? Well, PDGF is the most potent stimulator of what's called mesenchymal stem cells. These are the stem cells in your body. PDGF is the most potent growth factor for stimulating the proliferation, the growth of those stem cells among 23 different growth factors that were tested in this peer-reviewed published study. So I often say PDGF is the most important and the most potent growth factor that we have available to us in medicine and in aesthetics. This is another study, another peer-reviewed published scientific study where they looked at PDGF and looked at how does it increase, extracellular matrix production. Specifically in this study, they looked at collagen types 1, 3, and 6 and fibronectin from skin fibroblasts over a 2-week period of time. And in this study, which wasn't our study, right? This is a totally independent, peer-reviewed, published study. They found that PDGF stimulates up to a 600% increase in collagen type 1, up to a 2,000% increase in the production of collagen type 3, again, up to a 2,100% increase in collagen type 6, and a 400% increase in fibronectin. A third study, looked at PDGF and how it compares to other growth factors and cytokines for stimulating collagen and natural hyaluronic acid in your skin from your skin fibroblasts. They looked at 33 different growth factors and cytokines in this study. And again, they found that PDGF is the most potent stimulator of collagen and natural hyaluronic acid from skin fibroblasts. So that's all wonderful. It also, PDGF, we've also looked at it histologically in skin. And what we've seen is that it shortens the inflammatory phase. So you may be familiar with the different phases of wound healing, right? You start out with the inflammatory phase, then you go to the reparative phase, then you go to the remodeling phase, right? So you want to get through the inflammatory phase as quickly as possible and on to the reparative phase. And that's exactly what PDGF does for you. So in this study, where we looked at application of PDGF or just a standard of care onto skin wounds, and we did biopsies at 3 weeks and 6 weeks. You can see in the standard of care, what we call the previous standard of care group, right? Inside these white circles is a lot of inflammatory cells. All those dark purple dots in there are all still inflammatory cells in this wound. And in contrast to that, in the PDGF treated wounds, you can see at 3 weeks, much less inflammation, many fewer inflammatory cells, and all the pink material that you can already see really starting to form very nicely is all collagen, and that's at 3 weeks. And then by 6 weeks, there is an abundance of collagen, natural extracellular matrix, and almost no inflammation left. So we talked about how PDGF stimulates extracellular matrix formation. We've talked about how it stimulates the proliferation of your regenerative skin cells. This is a time-elapse video under a microscope showing how PDGF will attract these wonderful regenerative stem cells to the skin where you put it. So again, this is a time-elapse video. What you see under a microscope and what you see coming in from my left is this dark pointy shadow here. This kind of looks like a needle tip, is exactly a needle tip under a microscope. And it's going to express PDGF out of the tip of that needle. And these fluorescent looking cells are indeed fluorescent stem cells. And I want you to watch how the stem cells are attracted to the PDGF coming out of the tip of that needle. And this needle tip is going to move up and down, and you can watch how the stem cells are going to be attracted to the PDGF coming out of that needle tip, almost like a magnet. So here we go. Here's the tip of the needle. Needle tip now has moved down kind of towards the bottom, and you can see now it's moved back up to almost to the center. And see how the stem cells are like migrating to the PDGF coming out of the end of it? There you go. Somebody told me it looks like their 6-year-old child in a soccer game, like all the kids running to the soccer balls, right? So that gives you an idea as you apply PDGF to the skin, how it's bringing in all the regenerative stem cells. Okay. The other unique thing that I mentioned about PDGF, it's been FDA approved for 4 different therapeutic indications. One for treating these nasty chronic sores in the feet of diabetic patients. I'm going to show you a little bit more about that in a minute. It's been FDA approved also for stimulating the gum and mucosa tissue and the jawbone and the maxilla and the mandible in oral surgery. And it's been approved twice for use in orthopedic applications. So altogether, we have invested over $100 million in doing the phase 1, the phase 2, the phase 3 clinical trials, all the pharmacology and toxicology testing that FDA requires and is so important for you to have the assurance of safety and effectiveness, right? And there's been over 1,000 scientific publications, 150 patents, and again, 5 million patients treated with PDGF. This is a diabetic foot ulcer where the patient had to have a 4-foot amputation because they could not get the ulcer to heal. And they came to us and said, is there anything you can do to help? And so we used what was really a collagen sponge that we just saturated with the same recombinant PDGF that's in ariessence, and then packed it into this 4-foot amputation. One time, and you can see here at 4 weeks after the first treatment, the amazing amount of new tissue and healing that's been stimulated. And then we did another treatment at this 4-week time point, and you can see after the second 4 weeks, so i.e. 8 weeks in total, the wound was really completely healed. And here's an oral surgery sort of application, just showing the stimulation of the gum tissue and the jawbone. Oftentimes we get asked the questions, well, doesn't exosomes, don't they have growth factors in them? Or how does pure PDGF compare to exosomes? So I'm not going to belabor this too much, but I just wanted to give you a side-by-side, comparison. So again, Pure PDGF is recombinant. It's manufactured under exacting pharmaceutical, standardized conditions to exacting lot-to-lot specifications. Exosomes, of course, as you know, are derived from living cells or tissues, so you can have some variability, there. Pure PDGF has the 4 FDA approvals. Exosomes have never been FDA approved. Pure PDGF is sterile. Most exosome preparations are not labeled as sterile. Pure PDGF has, again, the precise sterility and lot-to-lot consistency, and every lot is tested for bioactivity. That is so important. So we test every lot to make sure that it's going to stimulate the skin cells to proliferate and to migrate into the area that you put it. Exosomes, to the best of our knowledge anyway, the best of my knowledge, don't go through at least that same level of lot-to-lot testing for bioactivity, or at least not with FDA validated assays. And again, we've talked about the fact that over 5 million patients have been treated with PDGF. So you have long-term safety and efficacy, which you simply don't have yet anyway with the exosomes. And again, as we say, the key thing here is if anything ever happens with a patient treated with an exosome, you don't have that FDA approval to fall back on like you have with PDGF. Another important thing we think, and this is a very simple experiment, but one that, I don't think had been done until we did it, is, again, with the 4 approvals of PDGF, right, it needs to be FDA approvals for surgical implantation inside the body. Those products must be endotoxin free. FDA mandates that if you're going to inject or implant any device or drug into the body, it has to be free of endotoxin. You probably know, right? Endotoxin is a major stimulator of general inflammation throughout the body. That's why the FDA mandates you cannot have any endotoxin in any product that is injected or implanted into the body. As you see here, as we set these samples out to an independent lab, 4 of the 5 exosome product contains very high levels of endotoxins, and the 5th product still contains some amount of endotoxin. So definitely not appropriate for application into a broken skin, or certainly not injected. This is how ariessence comes. It comes in a kit that contains 5 syringes of the pure PDGF, potent concentrated PDGF, and then 1 multi-use vial of the sterile hyaluronic acid. You withdraw 1.5 cc's of the sterile HA out of the vial, and you mix that with 1 syringe PDGF, which contains 0.5 ml of the PDGF. And so that will give you a total of 2 mLs, which is typically enough to cover a face during microneedling, a face and a neck, really during microneedling. If you do the décolleté area, you might need a second preparation of the product. Okay. With ariessence, most people report really 2 categories of benefits. The first one is evident almost immediately after application, and that is that reduction in inflammation that I showed you earlier histologically. So this is a case we say it's not magic, it's science, but that reduction in inflammation can happen literally within 10, 15, 20, 30 minutes after application, certainly within a couple of hours. And most patients just report a cooling sensation, less heat, and less discomfort following, say, an aggressive laser procedure or even microneedling. And then, of course, the second benefit, the main benefit, is all that wonderful collagen and extracellular matrix production that happens then over the next 3, 4, 5, 6 weeks. And this shows you, again, just the immediate sort of benefit that many patients report after the use of ariessence. So with that, I'm going to turn it over to David to talk about some of his cases. David?
Yes, thank you so much for that very informed and well thought out and scientific explanation of PDGF. You are the high master of all things PDGF, and your work in clinical research over the past several decades in this field is astonishing. So when ariessence came out, I knew immediately this was a product that I wanted to start playing with in my clinic. So if you look at this before and after, so this is a pretty aggressive radio frequency microneedling treatment on a patient. So this is a higher Fitzpatrick Asian patient that I RF'd at 4, 3, 2, 1 millimeters at very high settings. You could see how tight my overlap pattern is. And I was only comfortable doing this aggressive of a treatment on this Fitzpatrick Asian patient without risking any sort of PIH, post-inflammatory hyperpigmentation, because I had the use of PDGF. You could see immediately after microneedling with radio frequency, you could see how red and erythematous the skin is. And you could see 5 minutes post application, how that wound healing cascade has already been revved up and how the incredible decrease in inflammation is just happening right in front of your eyes. So this is an incredible application that I'm using it in my practice every single day to reduce that post-inflammation and also reduce some of the sequelae of risk that we have with some of our more aggressive treatments in our higher Fitzpatricks. So this is day 3, 5, and 7 on this patient. She's in her 70s. I did a fully ablative erbium laser on her. You can see it's a very aggressive treatment on her face and neck. Now, this is really interesting because I'm applying this PDGF with the HA immediately post erbium laser, and I'm getting fantastic results as far as the reduction of downtime, as well as the reduction of swelling. I don't know if there's any laser gurus in the room or people who use a lot of laser, but if you completely ablate the skin, that typically the number one thing you see is an egregious amount of swelling. So by activating that wound healing cascade and giving it exactly what it wants post-treatment, not only am I reducing the swelling, but I'm also increasing the healing and the result and decreasing the downtime. You could see by day 5, this patient is almost completely reepithelialized. And by day 7, she is 100% reepithelialized. Before using these specific products to help boost my healing post-procedure, when I did completely ablative procedures in my practice, it would typically take about 2 to 3 weeks for this patient to look at what she looked like at day 7. So you could see the incredible power of using PDGF post some of these very aggressive treatments. This is a great case. This is actually my scalp. And I've done a lot of different things to my scalp, but this is some before and afters of a series of doing PDGF microneedled into the scalp. Now, you could see an incredible increase in the hair density. We know there's great literature about just microneedling for increased hair growth, but I think the application of adding the PDGF into the microneedling regime greatly intensified the results, because I've been doing microneedling on and off for my scalp for the past decade, and I've never been able to truly achieve results like this in such a short amount of time. So you can see the increase of density, including the hairline and the crown of the hair. Of course, the hair is a little bit longer, so that's going to help with density as well. But there is a noticeable improvement when you're using this microneedle into the scalp.
And David, was this after one application? Did I miss
So
that?
I do a series of 3. You want to figure out what the underlying cause of the hair growth or hair loss is and address that as well. But you do 3 sessions spaced monthly. And then I typically do maintenance every 6, 9, or 12 months, depending on how aggressive the hair loss is.
And how many syringes of the PDGF did you use? And I assume, do you just use the PDGF, not the HA, right?
Yeah, just the PDGF, and I cut it with a little bit of plain saline when I do that to get it to spread a little bit. This is 2 syringes of PDGF. I offer it at my clinic as a 1 syringe treatment at a set price, but if they want to have like a booster, they can pay an additional cost, which is typically just the cost of the syringe of PDGF plus a small markup to kind of get a mega boost session and do 2 syringes at the same time. So this is actually post microcoring, mechanical microcoring. So I don't know if there's anybody out there that's doing mechanical microcoring, but this is a device that punches, basically does about 6,000 to 7,000 punch biopsies on the lower face that are about 370 microns wide, about 4 millimeters deep. And this is an open wound. So when I got PDGF, it just made sense to put this on this open wound. And this is just the plain PDGF. No, I did not use the hyaluronic acid provided with this, just to exacerbate the healing. And when you trigger this wound healing cascade and you give it the PDGF that it wants, theoretically, what I'm thinking the MOA is that it's just giving the body, the fertilizer it needs to really aggressively heal. So you could see as little as 4 days later, she's almost completely healed. Whereas typically when I'm doing these procedures, what you see at day 4 is typically around about day 7 or day 8. So definitely cutting down my wound healing time.
That's great, David. Fantastic cases. Clearly, anything else you'd like to, kind of add in terms of your tips and tricks that you've learned?
Specifically with the ariessence Pure PDGF, to make sure that you are applying it post wound event. Like I wouldn't necessarily use this post non-ablative or just apply it topically without any sort of wound healing cascade activation, because we know PDGF works along the wound healing cascade. So I think it's important to stimulate that cascade and then give it the fertilizer that it needs to proliferate appropriately. So I wouldn't do it anything like post non-ablative, or I wouldn't use it just topically alone. But I think it's a great adjunct to your plain microneedling, radio frequency microneedling, even things like the stratum corneum off, like a medium aggressive chemical pill, obvious lasers, microcoring, whether it's laser coring or mechanical microcoring, anything that's triggering that wound healing cascade. I think PDGF is a great adjunct to add to it.
Okay. Well, you're the master clinician, David. Those are amazing cases.
Yeah, thank you.
David, if you care to comment on any of these, just jump in as I go through them, because I am not a clinician. So you don't want me commenting on these, but if you'd like to provide a little commentary.
It looks like it's before a skin pin treatment, and that's after one treatment. So this is a baseline after one treatment and after 2 treatments. And you could see a great reduction in redness in the skin. You could see a great reduction in fine lines, overall clarity and smoothness to the skin. So we know skin pin or microneedling in general is great at inducing collagen and reducing these fine lines and wrinkles and pore size and improving overall texture to the skin. So it does make sense to use something like PDGF, which actually has a small enough molecule size to penetrate these tiny little microchannels that are created with a traditional microneedling system. So again, this is something that can work in tandem with something that you're already doing in your clinic, just to synergistically improve the results and reduce the downtime.
Very good. Is another microneedling case before and after?
Yeah, before and after. So, this is a great before and after, especially it being only a single case. You could see an overall improvement, especially look at the improvement around the eyes and the periocular area and around the mouth, and the improvement in the jawline contour. So you typically don't see a ton of tightening effect with microneedling, mechanical microneedling alone. But again, when you add products that work synergistically with that wound healing cascade that you're creating with the microchannels, I think results like this are definitely achievable. And I just see results like this in my clinic daily. This is a great one. So this is post microneedling, and then one application before going to bed. So you could see the patient said, my redness subsided within 4 hours. I was not red the next day. It made the microneedling experience much more comfortable with hardly any downtime. It's magic in a bottle. Now, I will say you have to explain to your patients that when you're applying PDGF post-treatment, that the recovery is different. Because I had a patient one time that I applied it post-treatment, and she wasn't red, she wasn't swollen, and she didn't think the treatment worked. She was like, it didn't work. I've had RF microneedling before, and I didn't have the redness and swelling this time. I think your machine was broken. She really said that. She really said that. So I had to show her the before and afters, and I was like, look, you had a great result. And she thought I was pulling her leg because she wasn't red and swollen and sore the next day. Thank God I take good before and after photos, because I showed her she had an actual improvement, but she had several sessions with me throughout the years. So this was the first time that I used this product on her, and she was convinced that I didn't do anything because she didn't have the same healing journey as she had the previous time. She healed too fast. So you have to warn them that, this does improve healing so much that it's not the same downtime that you're used to.
That's a good tip.
Yeah. So this is a combination of microneedling and CO2, throwing a little bit of PLLA in the mix of it. So you could see immediately and 6 days post, immediately post and 5 days post, and then immediately post and 6 days post. So lots of different before and afters here. But I do a lot of combination of laser with microneedling. And if you do a lot of laser microneedling combos, you know that they typically swell significantly. So you could see how red and irritated and even how much swelling some of these patients have, especially the middle patient immediately post, and then to have 5 or 6 days later to almost look like they had absolutely no procedure done. They just have good, clean, healthy skin is awesome. And I don't know if your patient population is like my patient population, but I think everyone now is used to Amazon Prime same day delivery. So everyone wants everything the exact same day. So by having products that we can use synergistically to decrease that downtime and improve the result is a win-win in my clinic. So this is a combination of post-halo BBL, which is a very common treatment. What I like to show patients with this is and show or talk to providers about this specific. So you see the before, you see immediately post-procedure, she's erythematous, she has a little bit of swelling. You see 2 hours post-procedure, that erythema and swelling is already subsiding. And you see 3 days later, the erythema and swelling is completely gone. If you've ever halo BBL'd somebody, you know they typically look like a Cabbage Patch doll about 2 to 4 hours later. So the fact that you're activating and helping that healing response, and I mean, Dr. Lynch, you can get into the science of it more, but in my opinion, I feel like you're activating it so synergistically that the body doesn't have to have that same swell factor that we typically have to have, because our body typically is swelling to get our own natural growth factors to the area. And it's like a gradient type thing. The more you swell, the more extracellular fluid you have, the more growth factors you have. But if you're applying a growth factor, specifically PDGF, immediately post-treatment, your body doesn't have to have that rebound swelling response that it normally would have after tissue injury.
Thank you so much, David and Dr. Lynch. Such a great conversation. We really appreciate both of you guys sharing your expertise and your incredible insights today. So a couple questions from the audience as you guys were presenting. Are you guys up for the Q&A?
Sure.
Yeah, let's do it.
All right, perfect. So first question, what's the typical duration of PDGF? David, I'll hand that to you.
Yeah. So as a topical, I'm saying that it's working synergistically. So in my clinic, in my opinion, it's giving me like almost double the payload of each and every single treatment. So I typically tell patients to do like a series of 3 microneedling sessions, and then about every 3 to 4 months, do an additional single session just to maintain that collagen boost. And since I've been using the PDGF, we've been able to extend that to, instead of doing their microneedling sessions 4 times a year, now they're doing them twice a year. So I'm getting a more synergistic result. So I'm getting less treatments throughout the year, but still maintaining a good result. So I think it depends on what application that you're using it in, but it's definitely extending the results of my current treatments by, I would say, at least 50% or longer.
Wow. Okay, great. Dr. Lynch, I'll hand this to you. Are there any clinical trials comparing PRP versus PDGF for hair restoration? I know you guys went through it a little bit in the slides, but can you give me a little more insight?
Yeah, no, to answer that question, no. There are no clinical trials that I'm aware of comparing PRP to pure PDGF for hair restoration. We are undertaking a clinical trial specifically with the pure PDGF for hair growth and also for some other indications. Our current plan anyway is not to necessarily include PRP in there, because for these FDA trials, and these will be FDA clinical trials like I'm typically used to running, right? They don't actually like you to put like another unproven experimental therapy in the study. They like for it to be sort of a head-to-head comparison of what they consider to be either a placebo or standard of care versus the material and product that you're testing. So it'll be a 2-arm randomized controlled blinded clinical study.
Okay, great. David, I will hand this one to you. Do you have any advice for combining regenerative therapies and treatments with PDGF?
Yeah, absolutely. So I think from my before and afters, you saw that I am combining it. So I think it's important to note that our patients currently want more with less. Like if I could find a place that I could get my nails done, my dry cleaning, my car washed, and like my gas all at the same place, I would probably go there once a week, you know? So our patients are wanting these symbiosis treatments, these like multimodality. So I'm combining PDGF topically with a lot of things. So I'm combining it with radiofrequency microneedling. I'm combining it with traditional microneedling. I'm combining it with lasers. So my PLLA and my CAHA. But you can apply it topically. You don't have to inject it. You can work by injecting your biostimulation and then microneedling your PDGF on top. So you're stimulating that wound healing fibroblastic pathway neocollagenesis from the inside out. And then you're doing the same thing from the outside in with your tissue injury, however you decide to do it, and your application of PDGF.
Amazing. Okay.
Hey, David, back to that last question. Did you ever use PRP for your hair restoration?
Oh, yeah, absolutely.
Clearly an N of one, but since we have you with us tonight, how would you have compared your results with Pure PDGF compared to PRP?
Yeah. So here's the thing about PRP. So I've been doing hair restoration for over a decade, and I've had a journey. So I started with PRP, and that was just kind of the gold standard. PRP, microneedling first, then PRP. Then I went to PRFM, and then I just went to PDGF. And here, what we know, and if you look at the clinical research around PRP in hair, that, and what you mentioned in your slide earlier, is that if a patient is young and healthy, PRP and microneedling is probably going to be great. Okay. But as we get more mature, and I'm saying like 30 plus, we have a steadily decline of the amount of growth factors found in our blood. And the PRP or PRF or PRFM is only as good as the patient. So now if I have a 60-year-old patient, nothing against being 60, I'm just throwing that number out there, but they're going to have a completely different number of growth factors in their PRP, PRF than a 25-year-old patient. I don't have a magic number for it, but if someone comes in and they're over 40, I'm more than likely going to talk to them more about PDGF than I would even recommend PRP or PRFM, just because I know of the steady decline that happens as we age. And I would much rather have a product that I don't have to draw their blood. It's ready to use. It's very, very simple to apply versus taking a shot in the dark, hoping that they have a high enough growth factor count in their PRP to make a difference.
Perfect. Okay.
Thank you. Great. Okay. One more question. Where can I buy it? And can we bring PDGF onto Moxie? I will take this one. So Moxie is starting a partnership with Ariessence. So please just ask your practice success manager and they can get you started. And with that, I will pivot us to the final question. If our audience would like to keep learning from either of you, what's the best place to find you? David, I will hand it to you first, and then Dr. Lynch, please.
Yeah. So probably the easiest way to find me is on Instagram. And my handle is at Ultimate Skin Source. Now that's all one word. I do respond to all my DMs. So if you have any questions about my protocols or anything like that, I'm a big believer in community and collaboration over competition. So I am an open book and I will share anything that I can with you to help elevate your practice. I'm a passionate teacher in the aesthetic space and I spend a third of my time doing that. Now, don't judge me based on my Instagram because I am a MySpace baby. So Instagram and TikTok's not my thing, but I do post a few times a week and I do respond to my DMs. So if you have any questions, feel free to reach out to me on Instagram.
Amazing. Thank you. Dr. Lynch, please.
Yeah, well, David made that comment about, being 60 earlier and how your blood was probably terrible and had no growth factors in it. So I might fall in that category. I don't have any social media presence that I do. I think some folks here at LRM Aesthetics may do some Instagram for me, but don't expect to get any direct response from me. That being said, I do a lot of lecturing all over the country. If you would like to reach out to any of the LRM Aesthetics folks and get my lecture schedule, see if I'm going to be in your area, I'd obviously welcome you. I will tell you, I know one offhand because I'm working on it today. I will be the keynote opening speaker at the MedSpa Pro conference coming up. I think it's in the first week or two of November. Again, either on our website, which is ariessence.com, or we're actually preparing a new website for Lynch Regenerative Medicine called lynchRegen.com. We will have my lecture schedule posted on those websites, or again, reach out to your local representative.
All right. Well, to everyone who joined us today, thank you so much for tuning in. Keep an eye out for an email with the recording of today's session. In that email, you'll also find a link to share your feedback. And just like we're constantly evolving our software and services based on your feedback, we do the same with this series. Your feedback really matters to us, so please don't be shy. I would also love to invite you to next month's Aesthetic Visionaries session with Dr. Gretchen Freeling, founder of G-Face MD and the Face It Live conference, along with aesthetic consultant Brittany Bresky. And you can register for that at joinmoxie.com/events. As a quick reminder, today's event was brought to you by Moxie. And if you'd like to learn more, feel free to check out our website at joinmoxie.com. Thanks again for joining. Huge thanks to Dr. Lynch and David Weir. Thank you both so much.
Thank you.
Thank you.
Thank you for listening to Aesthetic Visionaries. For more resources on building and growing your med spa, visit joinmoxie.com/learn.